Tuberculosis is an ancient disease, and over 2 billion individuals have tuberculosis.
In the Democratic Republic of Congo, MDR-TB is a huge issue. And there are no drugs. There are no drugs. There's not one single tablet available.
Doctors are capable of treating the patient. Systems exist to deliver treatment, and there are just no drugs available.
Our vision is to leave a world for our children that is free of TB.
The Innosight process, for the first time in my experience, we're confronted by people from all different spectrums who are interested in solving a definable problem about tuberculosis.
You take a very big problem, you break it down into little pieces, and you have people think about how do you solve those pieces, and then you reconstruct the little pieces back into a broader solution. And I think what we saw here in this process was people coming together and saying, well, why don't you do this? This would make sense, or why don't you do that? And so we actually saw some innovative ideas.
The splitting of the problem into its component pieces, bringing the best minds around it, but most importantly, allowing for broad-ranging creativity.
I had to sort of start at the ground zero and figure out, what this disease was all about and who some of the stakeholders were.
Well, it was really a collaboration between Innosight and the Lilly Foundation, and also the Stop TB Partnership, to make a connected network. The team and engagement level was so incredibly high. I think that as we were diving into the barriers, it became clear that people have tried to make attempts at these barriers many, many times before, but often have not had the opportunity to have other mindsets in the room.
I've never seen anything like this. And when I started and they went around the room, I said I was a little skeptical. And then at the end, I was a firm adherent believer. I think this is fantastic. I really think something will come out of it.
This approach can be very widely used, not just in healthcare, but around any social issue or impact issue, anything. It could be health, it could be education, it could be energy crises, it could be whatever it is. You can get people together that do not agree and say, let's put your politics aside, let's put history aside, let's look at the barrier and focus on how we can generate a solution for this specific problem.
There was a very high level of energy in the room, very high level of engagement, and a willingness to be playing a role in the ownership of the solutions that were coming out of this type of work. And I'm hopeful that those can be put into practice in the near term, so that we can actually have a true impact on MDR-TB.
Without this event, the path was pretty clear of where MDR-TB was going. And hopefully this will change the trajectory into meeting the needs of more patients and starting to raise the awareness.
I'm very optimistic coming out of today's work together. That optimism is tempered against the size of the challenge, but the only way we're going to resolve the challenge of MDR-TB is by finding precise methodologies to overcome the known barriers.